The pandemic in India is reaching a shocking new level this morning. The country has crossed another tragic threshold, 200,000 deaths, becoming only the fourth country behind the U.S., Brazil, and Mexico to hit that mark. The milestone passed after yet another record daily tally of deaths and a huge surge in infections that has left millions of people desperate.
My father is in a very critical condition. I'm getting no help. Numbers are given there, but nobody is responding. Numbers are not reachable. Please help me, please. My father is dying. I can't afford another loss. Yesterday I lost my younger brother.
Desperation as the healthcare system teeters on the brink of collapse. There's a massive shortage of hospital beds, medical oxygen, and vaccines right across the country. The world is responding. We're going to talk about that and some other key new details this morning. Ishan Garg is once again with us, a freelance reporter in New Delhi. And Ishan, every day we speak, the situation just worsens. More than 200,000 deaths now all told. But as we look at the daily numbers, they too jaw-dropping once again.
Yes, Heather, 360,000 infections in just the past 24 hours. This is another world record. India has, at this point, recorded more than 300,000 cases for 7 days in a row. This is not the sort of a record a country wants to make. At the same time, more than 3,000 deaths have also been recorded. That's the highest death toll the country has seen since the pandemic started. And officials are saying that the real situation is actually much worse while it looks bad on the surface. There are experts who are saying that the total caseload in the country could be, by conservative estimates, 10 times as worse, and by liberal estimates, 30 times as worse. The death rate, too, could be at the very least 10 times as bad in the country. There are concerns that there are many people with COVID-19 infections, and due to lack of proper medical facilities and testing centers, they're not being able to get tested for COVID-19. There are others who simply cannot get their results on time because the infrastructure is heavily loaded with a massive backlog of people who are getting tested. There are several people who, because of misinformation, are being misdiagnosed. While they are having COVID-19 antibodies in their systems, they are being misdiagnosed as influenza patients. So there's a massive concern among health experts here because they think that because India does not have the right numbers, its response to the pandemic has not been appropriate so far.
So, Ishan, let us talk about vaccination for a moment, because we know India has the largest vaccine manufacturer in the world in the Serum Institute. But the number I'm seeing is that only 1.6% of India's population is vaccinated. What is the problem? Is it simply a supply issue?
There are problems in a number of ways. So, for example, India started its vaccination drive in January and was hoping to vaccinate 300 million people by July, but it's lagging behind because, first of all, as you pointed out, there are supply issues. Secondly, there's an issue of vaccine hesitancy. A lot of people, they don't believe in the vaccine or feel like the vaccine is going to make them even sicker than if they contracted COVID-19. There's this concept in some people's mind that natural immunity, which comes through by contracting COVID-19, is much better than getting it through the vaccines. Now, the government says that it wants to vaccinate all people in the country. It's actually opening up vaccination for all adults in the country starting from May 1, and the registration for that starts today here. Now, the problem is going to be that India simply does not have that many doses. 1 billion people will become eligible for a shot from Saturday, but there are supply issues. Now, the government has tried to bolster production domestically by supplying grants of more than $500 million. But concerns are that the companies like the Serum Institute, they are going to manufacture doses now for domestic candidates first, and their other commitments for countries such as Canada are going to fall behind. There are the commitments with international organizations like COVAX facility and Gavi. That's going to suffer as well. So health experts here are saying that India needs to import more and more vaccines, and perhaps that's going to be a better way of solving the vaccine supply crisis than ramping up production only domestically.
Ishan, I thank you again.